Can an 80-year-old man get hard? A question that may bring a blush to some faces, but a very valid one nonetheless. The answer, in short, is yes. But there are factors that can make it more challenging for older men to achieve arousal during sexual stimulation as compared to their younger counterparts. Erectile dysfunction, or ED, is a common issue faced by older men. A study suggests that men in their 40s have a 40% chance of experiencing ED, and this rate increases by 10% with each passing decade. This doesn't mean, however, that men over 65 are doomed to live with sexual dysfunction. There isn't a miracle cure for ED, but lifestyle changes and scientifically backed medications can reverse symptoms and reignite the spark. Understanding why ED is a common issue in men's health and learning how to address it can lead to a more fulfilling sex life beyond 65. Erectile dysfunction is characterized by the inability to achieve or maintain an erection long enough for sexual intercourse. This issue plagues approximately 30 million men in the US alone. Age and ED often go hand in hand, so the risk of developing the sexual dysfunction increases as men age. Experiencing a loss of erection during sex can be incredibly frustrating, but it's important to remember that it happens to most men at one point or another. Understanding the potential underlying causes of ED can help guide treatment options. ED can stem from various medical conditions, medications, mental health issues, and lifestyle choices. A deeper dive into the common causes of ED in men over 65 can shed light on this issue. Health conditions such as hypertension or high blood pressure are often linked to ED. A review of multiple studies suggests that ED is a common issue among men with hypertension. In fact, about 30% of patients with hypertension report experiencing erectile dysfunction. Another study found that men with severe ED had a higher risk of developing hypertension and/or cardiovascular disease within 10 years compared to those with mild or moderate ED. An estimated 15% of participants in the study reported having erectile dysfunction at a 10-year assessment. Diabetes is another condition associated with erectile dysfunction. Men with diabetes are 3 times more likely to develop ED than non-diabetic men. Diabetes can cause nerve damage and vascular issues, leading to neurological ED. Other diseases and medical conditions that can cause damage to erectile tissue in men over 65 include chronic kidney disease, multiple sclerosis, atherosclerosis, physical injuries affecting the penis, prostate, pelvis, bladder or spinal cord, and complications from surgical procedures, such as surgery for bladder or prostate cancer. In conclusion, although erectile dysfunction is a common issue for men over 65, it doesn't have to be a life sentence. Understanding the potential causes and seeking appropriate treatment can help men regain their sexual function and enjoy a satisfying sex life well into their later years.